Welcome to the medicine niche. Whether you're a budding medical professional or just someone trying to ace their blood pressure checks at home, this video is for you. And hey, we promise to make it fun. Well, as fun as blood pressure can be. Step 1. Use the right equipment. Make sure your machine is validated, well-maintained, and properly calibrated. Step 2. Position yourself or your patient correctly. Sit down, relax, and rest for 2 minutes. Keep your feet flat on the ground and back supported. No coffee, no exercise, no arguing with your Wi-Fi provider beforehand. Keep it chill. Remove any tight clothing around the arm. Support the arm at the level of the heart, because gravity has no chill either. Step 3. Size matters. Use a cuff with a bladder that covers 2/3 of the upper arm. Place it snugly on your upper arm, just above the elbow crease. Step 4. Now here's the fun part, measuring. If you're using an automatic machine, press start and let it do the work. Once it's done, write down the numbers. Remember, the top number is systolic, pressure when your heart beats, and the bottom is diastolic, pressure when it rests. If you're using a manual cuff, here's the easy version. Inflate the cuff until you stop hearing blood flow sounds. Slowly release the pressure while listening through the stethoscope. The first sound, that's your systolic number. When the sound disappears, that's your diastolic number. It's not magic, just physics and a bit of patience. Finally, here is a golden rule: always take 2 measurements per visit. If the readings are very different, take a third. Consistency is key. Think of it as double-checking your favorite online shopping cart. It pays off. Remember, accurate BP measurement isn't just a skill. It's a lifesaver. Thanks for watching. Don't forget to like, subscribe, and share this video with anyone who could use some BP know-how. After all, healthy habits start with the right knowledge. See you next time in the medicine niche.